The last two open debate contributions are from Ivan McKee, followed by Brian Whittle.
Thank you, and Presiding Officer, I would like to take this opportunity, as members have done, to thank Tom Arthur for bringing this important debate to the Chamber today, and to all those involved in the preparation of the Hepatitis C Trust report. Presiding Officer, it's not often that we have the opportunity to eradicate a disease in its entirety, but today we're debating the possibility to do just that. If the correct steps are taken over the coming period, Scotland could be at the forefront of the global efforts to eliminate Hep C, making a huge difference to the lives of thousands of individuals and their families, current sufferers and those yet to be diagnosed or to contract the disease. And in addition, elimination would save the health service many millions currently spent on treatment and care that could be diverted into other priorities. There's much talk in healthcare of the preventative agenda, the concept that spending extra money now results in lower costs to the system later. Often the problem with executing on preventative spend opportunities is the difficulty in understanding and demonstrating the link between the extra upfront spend and the consequent savings, which often, for many reasons, do not materialise as anticipated. However, in the case of Hep C elimination, the relationship is much more clear-cut. Every year a number of cases are treated, and while new medicines have significantly reduced the cost to treat, the total spend is still high. Increases in treatment rates delivered now will result in lower rates of incident going forward. The numbers can be modelled and the resulting future costs of treatment in both scenarios evaluated. Over and above the savings from lower future treatment costs of the condition itself are the savings in costs of consequent conditions, for example, liver disease and care. Often preventative health measures can actually exacerbate health inequalities, with the middle classes listening to healthy lifestyle messages and acting accordingly. However, the elimination of HCV, will actually serve to reduce health inequalities, as it often affects vulnerable and deprived groups in society. I would also like to take this opportunity to raise awareness of the work being undertaken by Waverley Care and Abvey in Barlinnie Prison in my own Glasgow Province constituency, a project that I have visited and witnessed at first hand. The prevalence of hepatitis C amongst the prison population is estimated as high as 19%. As part of the project, a community link worker is embedded in the prison. They engage with and support prisoners with a Hep C diagnosis whilst in prison and upon liberation into the community. This ensures there is continuity of care and that the individual is not lost to the system, as is often the case otherwise. The pilot has proven successful and has now been extended to other prisons. The report makes proposals for inclusion in a Scottish Government implementation plan for elimination of the disease. This plan needs to provide robust modelling of the numbers required to be treated on an annual basis to reduce infection rates to the point where elimination is achievable. It also needs to model the financial impact, how much more needs to be spent each year and for how many years to increase treatment levels, and how much that will save in the long run. It has been estimated that elimination can be achieved within the existing budgets for Hep C, but it will require a different approach. Adopting flexible budget models that support NHS boards to deliver multi-year budget plans, and having ring-fenced budgets for Hep C with a minimum rather than a fixed treatment target. Negotiations with drug suppliers for a fixed cost for elimination over a given period could dramatically reduce cost per treatment. And there needs to be a whole system approach, ensuring that implementation and funding is coordinated at a Scottish level, and that savings achieved are monitored and then reinvested to accelerate the elimination process. By taking these steps, I believe we can look forward to the day when hepatitis C has been eliminated in Scotland. Thank you.